fellow human, my name is Dr. John Smith. Very good to see you today. Please do make yourself nice and comfortable in my clinic today. Right then, I think today we're going to be doing a cranial nerve exam, is that correct? Yes, very good. I myself love doing cranial nerve exams. Nothing I enjoy more than looking and examining a fellow human being's cranial nerves. Okay, but before we begin, of course, I must get some gloves on so that we keep ourselves nice and clean. We keep ourselves nice and protected from all the bacteria around us at all times. These pesky little microorganisms. Okay, let me get my gloves on. What's that? Why am I wearing sunglasses indoors? Well, I'm a little bit sensitive to light, a little bit of photosensitivity. I hope that's okay. Okay, good. I know it's a bit unprofessional for a doctor to be wearing sunglasses, but you know, we do what we must. Okay, before we get into the cranial nerve exam, let me listen to your heartbeat using the stethoscope. Yes, quite a magical piece of technology. Quite a magical piece of technology indeed. Yes, very good. Okay, I'm just going to place the stethoscope on your chest. Over your clothing is absolutely fine. And I'm just going to listen to your heartbeat now. Oh, that's good. That is so steady and consistent. What a marvelous human heartbeat you have. Absolutely marvelous. Yes. That's very good indeed. Right then, I believe the first thing I need to do today is a taste test. I need to make sure that your tongue is working. Okay, so what I have is little bottles that contain artificial flavors, 3 different flavors. I'm going to shake up the bottle and I'm going to put a little droplet of each flavor on your tongue, and then you're going to tell me what it tastes like. Okay, now let me just get the flavors. Okay, yes, here it is. Okay, I think that is sufficiently shaken up now. Okay, if you'd like to stick your tongue out for me, please. Very good. I'll put a little droplet there. Just a little droplet, that's enough. Just a little droplet. Can you tell me what that tastes like, please? Banana. Yes, very good. Well done. Let me just get the second flavor. Different flavor now. Okay, my fellow human, stick that tongue out once again. Here we go. I'm going to put a little droplet on your tongue. yes, raspberry indeed. Excellent, excellent job. That's all 3 flavors correctly identified. You're off to a brilliant start. Off to a brilliant start. Now, we're going to do the smell test. Very similar to the taste test, but obviously we're looking at a completely different sense here. The sense of smell. Okay. Now, I've got 3 bottles. These ones have 3 unique smells. I'm going to hold them up to your nose, and you're going to tell me what they smell like. Okay. Excellent. Let me just get those bottles. That should be enough. Let's see now. Could you take a sniffy sniff of that, please? And what do you think? What do you think that smells like? Freshly cut grass. Very good. Well done, well done, well done, well done. Right. We get the next bottle of smell. Different smell. Unique smell. Could you smell that one for me, please? What does that smell like? Wet dog. It smells like a wet dog. Correct. Correct. Well done. Well done. Smell number 3. Could you please take a smell of that? And what does that smell like? Petroleum. Petroleum, yes, excellent. I love the smell of petroleum. I can't get enough of it. Get it right up my nostrils. I love it. Okay, let's see now. What do I have to do next? Incoming message from the big giant head. Your last status report was sent 22 days ago. We require a new status report within 24 hours. Please submit your new status report, or else we will be forced to send a representative to Earth to check on your status. Resume normal functions in 3, 2, 1. What were we doing? What were we doing again? I've lost track. Oh yes, of course, the next part of the cranial nerve exam. The light portion. Let me grab my little light. Here we go. As you can see, a lovely blue light. What I want you to do now, I want you to keep your head perfectly still for me, please. And I want you to use just your eyeballs to follow the light as it moves. Look at it. Look at it. It's moving. It's already beginning to move. Are you following it? You'd better be following it with your eyes right now. Right flipping now. Yes, that's right. Just like that. Just like that. You're doing such a good job. Continue to follow the light as it moves. Okay, very good. The light might begin to move more organically, more erratically, less predictably. But you must continue to follow it with your eyes at all costs, no matter what path it takes, no matter what movements it does. Follow it. Follow the light. Follow nose, okay, exclusively. And what I'm going to do with the light, I'm going to bring the light into your field of vision, okay? Just different little places like that, sort of teasing the edges of your vision. I need you to tell me when you can first see the light, when it first comes into your field of vision, okay? Looking at my nose, looking at my nose, looking at my nose. Okay, good. Good, 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 good. Good, 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 good. Okay, good. 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 Yes, we're continuing. We're continuing. Good. We're going around again. Good. 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 Okay. Okay, that's excellent. Good performance there. Very good indeed. What is next? What is next? Let's do a similar test. I'm going to be looking at your peripheral vision once again. Focus on my nose, please. Now, I'm going to move my fingers in various different directions, and when they leave your field of vision, that's when I want you to tell me when they leave your field of vision. Okay, understand? Good. Let's go. Starting now, tell me when they leave your field of vision. Excellent. Let's go again. Brilliant. Let's go again. Brilliant. Let's go again. Very good. Now I'm going to take a step back and we'll do the same thing. We'll do the same thing. Same thing. Okay, here we go. Very good. Very good. Very good. Brilliant, brilliant job there. Your peripheral vision seems to be working very nicely indeed, but can you pass the finger wiggle test? That's the next test we're going to do. Okay, keep your eyes focused on my nose. Tell me which finger wiggles, left, right, or both. Starting now. Good. 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 Excellent job, excellent job. Another peripheral vision test. This time, the number of fingers test. Continuing to focus your eyes on my nose, please. I'm going to hold up a number of fingers in the corners of your vision, and you're going to tell me the total number of fingers being held up. Does that make sense? Excellent. Let us begin. Very good. Very good. Very good. Very good. Brilliant. Excellent. Excellent. Brilliant. Marvelous. Stupendous. Stupendous. Actually fantastic. What a great performance from you so far today. You have been doing really well. Looks like your cranial nerves are functioning very well indeed, but we haven't finished yet. We haven't finished yet. Oh no, 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 no. No, 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 no. There's a lot to do. A lot to do today. Now, the next thing I need you to do, I need you to focus on my finger, please, okay? Focus on my finger, and it's going to come closer to you. And closer and closer and closer. Keep focusing on it. Keep focusing on it, please. Keep focusing. Boop, right on the snoot. Boop on the snoot. Keep focusing though, keep focusing. Keep focusing. Oh, boop on my snoot. Boop on my snoot. Back to you, okay? Boop, boop on your snoot. Boop on my snoot. Okay, keep looking. focusing, please. Keep focusing. Okay. At any point during that little test, how many fingers did you see? Did you see 2 fingers? Or did you see 1 finger throughout the entire duration? 1 finger. 1 finger only. Are you sure? You're not lying to me, are you? You wouldn't lie to a doctor, a person, a medical professional. You wouldn't lie to a doctor, would you? No. Good. Okay, excellent. That's good. That's good. What's next? Let me bring the light back in and let us do a little bit of a thing where I cover up one of your eyes. Just like that, okay? Just like that. And I'm going to bring the light in and out of your vision. I might bring it a bit closer actually, and we'll do a little bit of this. That's it. Oh, that's it, isn't it? That's perfect. It's okay, just keep still. I know I'm being quiet, being a bit silent. Silence is okay sometimes. That's great, that's great. Okay, I'm going to do the other eye as well, of course. Let me just put that there. Let me just put that there. Is that good? Is that good? I think that's good. Okay, brilliant, brilliant, excellent job there. You did very well indeed. Now, what do I want to do with you next? What do I want to do with you next? Ah, yes, of course, of course. One last test utilizing the light. This time I need you to focus your eyes on my finger. It's a bit difficult, I know, because it's a black glove and it's a dark room, but do it anyway. Focus your eyes on my finger over here, okay? And ignore the light. Totally ignore the light, even though it might do some erratic things like come really close to you. Totally ignore it though. Totally ignore it. And focus on my finger. Focus on the finger only. Only on the finger, please. Only focus on the finger, please. Yes, that's great. Yes, that's good. That's good. That's good. Keep focusing on the finger. Only on the finger, not the light. Don't get distracted. Do not get distracted. We're switching it up. Fingers over here now. Fingers over here now. Focus on the finger. Ignore the light. Ignore it. Ignore it. Keep focusing on the finger, please. The finger. And ignore the light. Don't get distracted. Don't allow yourself to get distracted. Don't move your eyes from the finger. Do not move it from the finger. Do you understand? Good job. Good job. You're doing very well, actually. Very well indeed for a human. Let's see now. Ah, yes, of course. We simply cannot do a cranial nerve exam without an eye chart. The classic eye chart test. Let me get my eye chart. Let me get a pen as well from my pencil case. I just want something to use as a pointer, really. As a pointer, let me use this one, the simple pen. Did I just drop my pen? Goodness me, I'm a clumsy oaf, aren't I? Let me get that, where is that? Right, are you ready? Are you ready for the eye chart test? Very good. Stay where you are. Stay where you are, please. Don't come closer. Don't leave. really see these letters though, or are you just guessing? You can see them. Okay, what about this one? And this one? Okay, as long as you're certain you're not just guessing. Okay, good. What's that colour? What is that colour? Red. What is that colour? Green. Very good, very good. Could you now cover one of your eyes, please? Do it yourself. I'm too lazy to do it. Okay, very good. Now, random letters. I'm going to point to some random letters. You're going to tell me what they are. Very good, very good. Can you hear that? That loud car outside my office, disrupting the peace. Don't they know that we're practicing medicine in here? We're being doctors in here. We're seeing patients in here. This is an environment that requires peace. It requires peace. And they're disturbing the peace with their stupid car, their stupid little automobile, low technology combustion engine, loud. Right, cover the other eye, please. Cover the other eye. We still have a few letters we must guess, not guess, correctly identify with your good eyesight. Okay, few. Okay, let's go. Good, 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 good. Okay, that's the eye chart done. Eye chart finished. Eye chart finished. Bye bye, eye chart. Bye bye. There it goes. Bye bye. Now then, what's the next part of today's cranial nerve exam? I think your eyes are brilliant. I think there's no need to look any further at your eyes, no need to examine them any further. But something that I have neglected so far is your ears, your ear holes. And I'm about to go in those ear holes, baby. I'm about to go in those with an otoscope. What is that? What is going on outside? Are these crazy people dropping metal objects out there? Unacceptable, unacceptable. Let me get my otoscope. Here we go. Got the brand new otoscope. Nippy nip there. So it's nice and hygienic. There it is again. Can you hear that sound outside? Metal being dropped on concrete. What an appalling sound. Appalling. It hurts my little human ears. Right, enough of that. Let's look inside these ears, shall we? Oh, that's interesting. Oh, that's interesting. Very interesting indeed. I see. So you have a little bit of earwax in here. A little bit of earwax. But I don't think it's excessive. I don't think it is excessive. I think that's the normal amount of earwax for a human ear. So let me check the other side as well. Maybe I can have a look in here and see if it's the same. Yes. That looks the same. That does look the same actually as the other ear. So I think that's a sign that you have normal earwax amount in your ears. Okay, now let's do some rudimentary hearing tests, shall we? Firstly, I'm going to whisper a word into your ear and you're going to repeat it back to me, please. Let's go. First word, here we go. You ready? Here we go. Technical. What did I just say then? Technical. Yes, very good. Right, the next word. say then? What was that word? What was that word? Coconut. Yes, coconut. What an absolute fruit. Is it a fruit? Is it a nut? I don't know, but it's great. That's what I say. That's what I say. Love a bit of coconut. Right, next word. Next word. Liquid ammonia. What did I just say then? What did I just say then? What was that? Liquid ammonia. Yes, very good. Well done. Well done. Let's do some numbers, shall we? Let's do some numbers. 1270. What number did I just whisper into your ear? 1270. Correct. Correct. Let's do another one, shall we? Another number. 856. What was that number? What was that number? 856. Correct. I think so. Did I remember that correctly? I think so. I think so. Okay. Okay. Next. Ah, yes. Yes. We're going to continue with the ears for a little bit. I want you to close your eyes, please, and don't open them. Don't open them. No cheating. If I catch you cheating, I'll give you a little smack. You think I won't smack you? You think I won't smack you? I will. Okay. So don't cheat. Keep your eyes closed. I'm going to produce a sound either to the left of your head or to the right, and you're going to tell me which side the sound is coming from. Okay, left or right? Let me get my little sound making object. Here we go. I'm coming in with the sound. 3, 2, 1. Was that left or right? Good. 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 Very good. Okay. Okay. Now I think we're going to use the same sound producing object, but this time what I'm going to do is I'm going to make 2 sounds, and you're going to tell me which sound is closer to you. Sound number 1 or sound number 2. Okay. Let's begin that now. One or two, which was closer to you? Very good. One or two, which was closer to you? Very good. One or two, which was closer to you? Very good. One or two, which was closer to you? Very good. Okay, I'm very happy with what I'm seeing so far. I only have a few small tests to do with you now, and then that will be the end of the cranial nerve exam. But we must do the last few tests. Okay, the next test is something called the sharp or soft test. I'm going to poke you. You can open your eyes now, by the way. You can, actually, no. Keep them closed. Keep them closed. Just for this next one. Okay. I'm going to poke you in the face, probably on your cheeks, maybe your forehead, whatever. I'm going to poke you with an object that will either feel sharp, and don't worry, it won't be painfully sharp, it's just going to be slightly sharp, and then the car again, really, right, and then the second object is going to be soft. It's going to be so soft, you will be able to tell the difference very easily, I think, very easily indeed. So, let me do that. Here we go. Are you ready? Was that sharp or soft? Good. Was that sharp or soft? Good. Was that sharp or soft? Was that sharp or soft? Good. Was that sharp or soft? Good. Was that sharp or soft? Good. Okay, you know what? You can open your eyes now. You can open your eyes now. I think the last couple of tests, very simple, pretty quick. Okay, now I need you to make some facial expressions for me. Might seem a bit silly this, but let's do it anyway. I want you to puff out your cheeks, please. Excellent, very good. I want you to grin. Show me as much of your teeth as you can. Yes, really go crazy with it. Good. Now, smile for me. Closed mouth smile. Yes, 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 very good. Can you make a sad face? Something like that. Yes. Frown for me, please. Frown for me. Furrow those eyebrows. Very good. Now, raise the eyebrows as if you're surprised. Very good. I think that's everything. Can you flare your nostrils for me, please? Okay, very good. Now, I'm going to put my hand on the side of your head. I want you to push against it. I'm going to apply a little force. Very good. Other side. Let's go. Very good. Very good. Tilt back against my hand now. Push up against it. Push up against it. Very good. Now, underneath your chin. Tilt your chin down against my hand. Very good. Very good. Very good. Now, I'm going to place my hands on your shoulders. And you're going to shrug up for me, please. I'm pushing down. Okay, good. Now, put your arms out. Extend your arms. I'm going to put my hands on top of yours. There we go. You're going to raise your hands, your arms against me. Okay. Okay, good. Now, putting my hands underneath yours, you're going to push downwards. Push downwards, push downwards. Yes, very good. Very good. Putting my hands on the outside of your arms, I want you to push outwards, okay? Push outwards. Okay, good. Now, putting my hands inside your arms, so to speak, I want you to squeeze them together. Squeeze them together. Okay. Excellente. Excellente. You did so well. You did so well today. I think that is the conclusion of our cranial nerve exam, and I just want to say thank you for doing so well, for being so nice and polite and pleasant, and for following all my instructions perfectly. What a great human being you are. Absolutely fantastic. Okay, so I might see you again in the future for some more medical examinations. I am a doctor after all. I do medical examinations. So maybe I'll see you again in the future. Very good. Have a good night. Bye. Hello there, fellow human. My name is Dr. John Smith. Very good to see you today. Very good indeed. Please do make yourself nice and comfortable in my clinic today. Now, I believe you are here for an ear cleaning session. Is that correct? Yes, excellent, perfect. I love cleaning out ears. I just love getting right inside those ear holes and giving them a good, thorough cleaning. Goodness me, I just enjoy it. I don't know what it is, I just enjoy it. But before we get into that, I must put on some gloves, okay? And I'm going to take a little look inside your ears with an otoscope to see what we're dealing with, okay? Let me just get my gloves very quickly. Where are, yes, there. Yes, my gloves are on perfectly now, perfectly. They feel absolutely fantastic. And now, yes, the next thing I need to do is I need to actually look inside these little ears of yours, look inside them using an otoscope. So, let me get my otoscope. Let's assemble this little bad boy, shall we? This little bad boy. Little bit fiddly. Little bit fiddly. It's small, isn't it, and delicate? There we go. There we go. That's absolutely perfect and ready to use, and lovely and hygienic, of course, brand new, brand new. Now, I'm going to stick this in your ear hole, okay? I'm not going to go too deep though, don't worry, it's not going to be uncomfortable, not going to be uncomfortable at all. And I'm just going to look through it, and I'm going to see what is going on in this ear hole of yours. What is going on in this ear hole? Right. I see. I see. You have a lot of earwax, don't you? Goodness me, that is a lot indeed. That's a crazy amount of earwax, in fact. I can see why you booked yourself in for an ear cleaning today. Have you been... How did you notice you were so disgusting and full of earwax? You could feel it. You feel bunged up in the ears. Goodness me, there is a lot in there, but don't worry, we're gonna get it out today. Today's ear cleaning, it's going to be fantastic. I'm just going to look in this ear now as well. Let me just see. There we go. Let's have a look here. Is this like the other ear? Yes, it is. Yes, it is. It is also disgusting. Okay, so you did the right thing by coming to see me today and to get your ears cleaned. Absolutely essential that we get these done. Now, because you have quite an advanced case of disgusting ears, what I'm going to do is, first of all, I'm going to use a special liquid solution. I'm going to have to give it a little bit of a shake first, though, okay? A little bit of a shaky shake. And then I'm going to put a few droplets in each of your ears, and it's going to dissolve and soften the earwax a little bit to make it easier for removal. Okay, let me just get my special liquid solution. That is absolutely perfect, perfectly shaken. And now, if I could ask you to tilt your head ever so slightly for me, please. Very good, that is perfect. Look at that. Look at that, a few little droplets. A few little droplets in the one ear. You can correct your head now, that's absolutely fine. You might notice you hear a little bit of a fizzing sound. Not unlike Rice Krispies Snap Crackle Pop. It's a lovely sound, I think, personally, but that just means that the solution is taking effect. So it's actually a good thing. Now, let me just shake up the solution once more for the other ear. Okay. resuming normal functions in 3, 2, 1. What was I saying? Yes, we're going to allow the fizzing to take effect. I think it's already been quite a while, hasn't it? I think it's taken effect enough. I think your earwax is probably fully softened and ready for extraction by now. I think so. I think so. So, let me get my first little tool, and then we're gonna go diving inside those ears of yours for some cleaning. The first tool I'm going to be using today for cleaning is the humble loofah. The humble loofah. You might think to yourself, that's absolutely outrageous. A loofah to clean out an ear hole. How will it fit? How will it fit? It simply will not. It's too large. That's what you think. That's what you think. You don't have the proper insertion technique that I have. I have mastered the insertion technique. You know what I'm saying? You know what I'm saying? Absolutely mastered it. So, without further delay, sit there, remain calm, and enjoy. It should be quite relaxing, actually. Very good. Okay, just going to be doing one ear at a time, using the loofah method. The loofah method. There it is. Got right in there with the loofah there. That's perfect. That's the spot. That's it. Excellent. Going to be going on the other ear now as well. Of course, we must do both ears evenly. Of course, of course. Excellent. Absolutely marvelous. Now, let us not forget the other ear as well. Of course, the other ear over here. Let's go. Okay, I think that's a good little bit of a cotton bud done. But now I'm going to introduce you to something called an ear brush. It's specifically made for the ears. You'll know when you see it. One moment. You see it, the ear brush. I'm sure you're very familiar with this. I'm sure you're very familiar with this implement indeed. I see many human beings, fellow human beings, use it to clean out their ears. They just go right in there and they give it a good brush. I believe many humans, myself included, as a fellow human, make it a part of their daily cleaning routine. Once a day brushing their ears. Very important indeed. Now then, enough faffing about. Let me actually start cleaning your ears. Now this is going to feel quite intense, but it should be nice and enjoyable regardless. sounds. Now, prepare yourself for the other ear. Here we go. That's it for the humble ear brush. Okay, that's it for that tool. And now we're going to move on to my fourth and final ear cleaning tool for today. And that is a special little brush indeed. Let me grab it for you and show you. We have here another little brush specifically designed for cleaning ears, and only for cleaning ears. That is its only purpose. This is another ear cleaning brush. Now then, this one is so soft, whilst the other ones were a little bit firmer and had more bristles, more harsh, rigid bristles. This one is softer, much softer indeed. Allow me to begin cleaning your ear. say good night a little bit early to you today. Good night. My fellow human, my name is Dr. John Smith. How wonderful it is to see you today. Wonderful it is indeed to see another fellow human. Right then, today I believe you're booked in for a hearing test. Is that correct? Yes, a hearing test. Test number 1. Did you just hear that noisy car going past outside the office? You did? Well, that's a good start to the hearing test indeed. That was just a little joke. Little joke, that's not really the hearing test, okay? Now, the first thing I need to do for this hearing test, I need to put these headphones on your head. Of all places to put a pair of headphones on the head seems like the most reasonable and likely place for them to go, wouldn't you agree? Wouldn't you agree? Yes. Yes, indeed. We shall put them on the cranium. We shall put these lovely little cushions on your ears, and they shall feel oh so soft. Oh so soft and wonderful. Goodness me. Listen to the sounds they make. Can you hear the sounds? That's the sound of cushiony comfort. Cushiony comfort. And your ears are about to be enveloped in cushiony comfort. You know what I'm saying? You know what I'm saying? Those ears are in for a treat today, baby. An absolute treat. Okay. Enough waffling. Enough waffling. Let me get those on you. Is that nice and comfortable? Bit awkward with the wire. One moment whilst I plug the wire in. Okay, plug the little wire in here. There we go. I believe that's on. Now then, the first thing I need to do with you is something that we call in the industry the beep test. Okay, very important hearing test. I am going to be playing through my little device many beeps was that? Very good. Let's keep going. How many beeps was that? Very good, very good. A few more, okay. How many beeps was that? Excellent. How many beeps was that? Okay, brilliant. Last one. One more. Let's do one more. How many beeps was that? Okay, fantastic. Fantastic. You've done so well. You've done so well at the beep test. A brilliant start to the overall hearing test today. Now then, at this point in the hearing test, I would like to put on a backing track. It's going to be playing through the headphones constantly throughout today's appointment. Okay, just ignore it. That's there. It's partially to relax you, but also it is to make it slightly more challenging, a little bit of a distraction maybe. Will you be able to pass the hearing test with the backing track? Here we go. There, so you should be able to hear now a lovely little backing track. That's actually a special magical frequency which heals you biologically on a cellular level. What is it, 528 hertz? I think so, but I can't really remember. Not entirely sure off the top of my head. Okay, right. Now we're going to do something called the left or the right test, and I think that you can work out what is going to happen from that name alone. I'm going to be making sounds to the left or to the right side of your head, utilizing this microphone, of course, which is hooked up to your headphones. You know that, though. You know that. And I want you to close your eyes, please. Close your eyes throughout the entire duration of this test. And I want you to tell me which side of your head the sound comes from, the left or the right, and hopefully the cars in the background will add to the challenge. You know what I'm saying? Excellent. Let me grab my first sound producing object. Are your eyes closed? No peeking. This is a medical examination. You only cheat yourself by cheating. You know what I'm saying? Good. Keep them shut. Keep those eyes closed. Here we go. Sound number one, baby. Sound number one. Left or right? Brilliant. Here we go. Left or right? Excellent. Left or right? Very good. Left or right? Good. Let me do that one again. That was a bit rubbish, wasn't it? Sorry about that. Here we go. Left or right? Good. Excellent. Left or right? Yes, very good indeed. Left or right? Marvelous. One more. Left or right? Very good indeed. Now, let me just grab my next object, okay? was I doing now? Yes, grabbing the next object for the left or right hearing test. I remember now, I remember now. Let me just grab that object. Oh, you're in for a treat. You're in for a treat with this one. Are those eyes still closed? They'd better be. They'd better be. Let's go. Left or right? Good. 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 Which sound is closer? 1 or 2? Test. Okay, working on the name there. Working on the name. We need something a little bit more succinct, don't we? A little bit more succinct. But it is descriptive. It is descriptive, and I think without even an explanation, you can tell exactly what you're going to need to do for this test. Isn't that correct? Yes, yes, I think so. Okay, so keep your eyes closed. Don't open those eyes. Okay, let me grab my first object for this test. Just a moment. This is not the test yet. I'm merely getting the object for the test. Okay, just retrieving it. Okay, as the name of the test suggests, I'm going to produce 2 sounds, and you're going to tell me which of the 2 sounds is closer to your head, 1 or 2. Let's begin that test now. 1 or 2. Good. 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 Good. Okay, I think that's enough utilizing the pen. Let's use a different object, one that might be a bit more difficult perhaps. Let's have a look. What shall we use next? Here we go. Are you ready? Which of those was closer, 1 or 2? Good. 1 or 2. 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 Good. Just one more utilizing this. Just one more. 1 or 2. Very good. Very good indeed. I'm impressed so far, but that is not the conclusion of this test. Okay. Now, the next object. One moment. Are you ready to continue? Keep your eyes closed. Keep your eyes closed. Here we go. Which was closer, 1 or 2? Good. 1 or 2? Good. 1 or 2? Good. the same test. Which sound is closer, 1 or 2? Here we go. One or two. Good. 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 Okay, very good. I do kind of want to continue with that object because personally I love the sound it makes, but you're probably getting bored by now, aren't you? You poor simple-minded creature with your small little brain, and you just keep destroying it further and further by watching TikToks, don't you? TikToks. Oh goodness me, you simple primitive creature. You have to watch something that changes every 15 seconds, otherwise your attention fizzles away. Fizzles away, doesn't it? Doesn't it? It's okay to admit. It's okay to admit. I enjoy a good TikTok from time to time myself, you know. I do. Now then, the next. Yes, of course. The next part of today's test is the whispering words test. I'm going to whisper some words and probably some numbers as well into one of your ears using the microphone here, and choices to stun. Yes, of course, the pacifist route, not my preference personally. Let's continue. Crop circles. What did I just say then? What did I just say then? Crop circles. Yes, very good. Let's do some numbers, shall we? Some little numbers. Spice things up a bit. 624. What number did I just say then? What number did I just say then? 624. Yes, very good. Let's go again. 7,122. What did I just say then? What did I just say then? 7,122. Yes, well done, well done, well done, well done. Just a couple more numbers, okay. 417. What did I just say? What did I just say then? 417. Exactly. One more. One final little number, if you do not mind. 315. What did I just say then? What did I just say then? 315. Yes, exactly. Okay, my little human friend, my fellow human friend, of course. Excellent job so far. Excellent job so far today with the hearing test. We're actually almost at the end of the hearing test. I have merely one more test that I need to carry out with you. But I do think that after that test, I might do a little relaxation therapy on you, if you are so inclined. Yes, that sounds good to you. Marvelous. The thing is, you see, with this backing track healing you on a deep cellular level, I can also utilize a few other sounds, a few other objects to relax you, to send you into a state of deep healing and trance. Does that sound like something you'd be interested in? Yes, of course, it's a wonderful, pleasant experience, and one where you will fall into a deep sleep, a deep restorative sleep, of course. But first, the final test of today's hearing test. Let's go. Utilizing these majestic little pink liquid orbs. Look at it. Look at the majesty. Holy moly. The absolute majesty. Possibly one of the greatest human inventions of all time. Certainly one of my favorites. Right, what we're going to do is we're going to mark the edges of your hearing capabilities, so to speak. What I'm going to do is I'm going to produce the sound. I'm going to move it further away from you, and you're going to tell me when you can no longer hear it. Okay, let's begin that now. Tell me when you can no longer hear this, please. Good. Again. Good. Just the one ear now. Good. Again. Good. The other ear, of course. Good. Again. That's absolutely marvelous. Absolutely marvelous, my fellow human being. It appears that your hearing capabilities are perfect, delightful, excellent. I couldn't ask for better hearing ability if I wanted it. So, my fellow human being, I believe you have passed your hearing test today, and there is absolutely nothing to be concerned about. In fact, you should be elated, absolutely proud, happy, content, all manner of good things. And now, I'm going to do that little relaxation therapy on you that I spoke about earlier, just to help you to sleep well tonight and to heal. You know what I'm saying? Sit back and enjoy. And thank you for coming to see me, Dr. John Smith, your fellow human doctor. Good night. Hello there, fellow human. My name is Dr. John Smith. Very good to see you today, very good to see you indeed. Welcome to my clinic. Now then, I believe today we're doing some eye investigation, some examination of those delicious eyeballs that you have there. Yes. Now, today it's all going to be about lights. I'm going to start with this light here, very special. As you can see, can you tell me though, what color is this light? Purple. Yes, I would say a purple color. Excellent. Now I want you to focus on the light, please. Does the color of the light change at all as it moves to different areas? What about here? Is it still purple here? Okay, very good. What about here? Is it still purple here? Is it still purple? Okay, very good. Not noticing any change in color at all. Okay, you can notice a slight change. What's the change like? Sort of between blue and pink. Interesting. Okay, that is very interesting indeed. Excellent observation. Well done on noticing and on communicating that to me. That's wonderful. That's wonderful. Do you see the same effect in different locations? Yes, you can see it here a little bit. Okay. What about here? Yes, same effect a little bit. Okay. Okay, very good indeed, very good indeed. Okay, that's enough, I think, looking at the color of this light. I have two other lights as well. We're going to be doing the exact same thing. Okay, we're interested in the color of the light. So what color would you say this light is? Yellow. Yellow, yes, very good, I think so. Now then, is the light changing color down here for you at all? Think about the previous light and how it changed a little bit in your eyes between blue and pink and purple. This one here, any change? Not really. Possibly it goes to white. I see. That might just be the brightness, do you think? Or does it actually look white to you? Okay, that's interesting. Let's try in this corner of your vision, shall we? What about here? How is that looking? Yellow. Does it look yellow? Yes. You would say this light goes from white to yellow to orange. Interesting. Good observations indeed. Does it happen here though, at the top of your vision? Not quite to such an extent. Okay. That's quite brilliant observation. Here it's much more powerful. Right, that is interesting. That is interesting. Well done on communicating everything you're seeing today. You're doing very good. A lot of the time I just get a bunch of mumbling idiots in here, and they can't tell me anything useful at all. They just say, yes, doctor, no, doctor. Yes and no, doctor. What am I supposed to do with that information? Almost useless. Can't really blame them though. The human brain isn't particularly well developed, you know. Quite small, quite primitive indeed. Okay, I just want to check the lower central portion of your vision. Again, is this less intense than the corners? Yes, much less. Very good, very interesting. Wonderful. There is one last light that I want to do the same thing with, okay? I know it's a bit boring, but please bear with me, okay? Bear with me. And this examination today is going to be a little bit slow, okay? That's just the nature of this examination. Now what color is this light? Blue. Very good indeed. Now then, the corners of your eyes appear to be where any color change is most sensitive, is that correct? Perhaps here. Are you noticing any color change with this light? Not so much. Similar to the last one. Sort of becomes a little bit whiter, perhaps. Interesting. So you would say white to blue. Sorry about that loud car door outside. Just going for the corners as well. Seems very sensitive, the corners of the eyes. Just, okay, down here. Okay. No more observations to share. Roughly the same as the last one. Okay, that's good. How about just want to check the central lower? Not much effect here at all. Okay. Even compared to the upper center. This one's much of a less effect. Okay. Good. Good. You know what? Absolutely fantastic results and communication there. I've already got a lot of information from you. Indeed. Very happy with that. Incoming message from the big giant head. The big giant head is disappointed with the last batch of human cereal that you sent him. He did not enjoy the flavor of shredded wheat. Perhaps you could try sending him a different Earth cereal. He has heard great things about Cheerios. Thank you for your attention. Normal functions will resume in 3, 2, 1. Okay, what were we doing again? I seem to have lost my train of thought slightly. Yes, now we're going to utilize 2 lights. Let's see, I want to use the purple one. The purple one was quite different, wasn't it? It's just got this annoying little thing on it though that I hate personally. I'm talking about this thing here, the flippy floppy. The flippy floppy. Absolutely irritating. Why don't I remove that right flipping now? Why not? Why not take action? If something irritates you, take action to solve the problem instead of just complaining about it. Isn't that absolutely correct? We've got too many complainers in this world and not enough action takers. And that is why this planet is in the state that it's in. Absolutely abysmal. You know they put fluoride in the waters, fluoride in the drinking water, so that all the humans, fellow humans, myself included, of course, our pineal glands get calcified by the fluoride in the waters. Maybe that's why we're all acting so dumb all the time. Maybe that's why we're like dumb herd animals. Okay, just give me a moment to remove this annoying tingly dangly. There we go, tingly dangly successfully removed. Now we simply have 2 fantastic lights. Let's go. Okay, actually, I want to trade the blue. I want to trade the blue for the yellow light. Okay, I need some contrast in the colors. I believe the purple and the yellow contrast the most. Yes, look at that. Perfect, perfect. Okay, now keep your head nice and straight for me, please. Try not to move your head too much during this. I want you, please, to focus your eyes on the yellow light and to follow it as it moves. And only follow the yellow light, okay? Don't allow yourself to get distracted by the purple light. This is very, very important. Continue to follow the yellow light only as it moves. The movements may get quite unusual, quite erratic, quite organic, or they might get very regimented, very strict, very linear, almost unnatural in their perfection. How is that possible? Does anything in nature conform to such strict formation and pattern? Of course it does. Of course it does, you absolute buffoon. Nature is a mixture of chaos and order, of course. Great job. Now focus your attention on the purple light instead. Okay, you should be following the purple light now as it moves. And you should be ignoring the yellow light. Be careful not to get distracted. Okay, be careful not to get distracted. Keep following the purple light. They might get quite close. They might get quite far away. Who knows, but you need to continue to follow it regardless. The purple light. Following the purple light. Following the purple light. Following the purple light. Absolutely fantastic, phenomenal job you're doing. Fantastic. That is absolutely marvelous. Brilliant job. Brilliant job. Okay, let me think. What else do I want to do with you? Okay, for this next part, I would like you to focus your eyes on my nose, please. It doesn't really need to be my nose, just a central location. Keep your eyes focused there eternally throughout this portion of the test. Now then, I'm going to be bringing the light into your vision, just very gently, and I want you to tell me when you can see it, when it first enters your field of vision. Okay, let's begin doing that now. Good. 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 We're going to continue and keep telling me when you can see it, okay? Okay, good. Continue to tell me, please. Let's try down here. Okay, that's very good, very good. Doing excellently today, by the way, with the patience and the focus. I really do appreciate it. Very good, very good, very good job indeed, very good job indeed. Okay, let me see what I want to do with you next. Sounds a bit like an animal, doesn't it? Either like a purring gentle, low guttural warning. Interesting. No, this is a very large toothed comb. It's my favorite. It's my favorite for my hair, my human hair. I like to style it and do all sorts of human things with my human hair. Okay, but now what we're going to do is I'm going to place the comb very close to you indeed, and I'm going to be moving the light between the teeth. I'm going to be observing how it impacts your eyes. Okay, now it might take me a minute to get it perfect. I'm going to do this a few times, a few scanning times. Scanning your eyes here. Scanning back and forwards. Let me get one last scan there, and I want to try the other lights as well, different colours, see if they have any impact here. Okay, let's see about this one, shall we? How does this scanning affect you? Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Excuse me, my comb is dirty. The teeth of my comb is dirty. Okay, listen, human beings, we aren't perfectly clean. Okay, in fact we are quite disgusting and dirty. It's just the nature of us. I shower, I wash my hair regularly, but still, inevitably, there will be a little bit of dirt on the comb. Okay, I'm sorry, I'm not perfect. Obviously you're perfect, aren't you? Yeah, you don't have any dirt, ever. You don't produce any sort of nasty things. No, you're perfect. Of course you are, of course you are. Complaining about the dirt on my comb. Get a life. Get a life. We're doing it once more. Okay, I've got a third light. You don't remember that, do you? You don't remember that. Pea-sized brain. Pea-sized brain. Okay. Silence whilst I scan you. The purple light. Oh, this one's not going to be as good as it, I don't think. No. Because you need a small LED, a small single LED, to really get the good scanning effect. We will, however, do a few scans. Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Through the back, perhaps. Through the back. But then you don't get the intense bursts, do you? No. Okay, the purple light with the big tooth scanning is a failure. A failure, in my opinion. But that is some good data that I just collected there. Some very good data indeed. Now, what do I want to do with you next? Let's have a look, shall we? My little list here. I keep a list of things that I want to do with you, so I don't forget. Okay, what's next on the list? Next on the list is we're going to utilize the yellow light for this. You're going to look at my nose once again. We're going to be doing the opposite, kind of the opposite of what we did previously. I want you to tell me when the light leaves your field of vision, okay? Here it goes. It's moving. It's moving. Tell me when it leaves your field of vision. Good. And we're going to do that multiple times. Multiple different directions. Good. We're just checking whether or not you have good peripheral vision. Excellent. A good range. A good range. Checking. standing far away from you. Remember, tell me when it leaves your field of vision. Interesting, very good, telling me the range of your peripheral vision there, but also I was just thinking to myself about how you get the flare effect of the light in your vision depending on the angle at which the light is positioned towards your eyes. Does that make sense? You can change the angle, get more of a flare effect. I personally love the flare effect. I love the flare effect. I don't know why, but my brain enjoys it. Interesting. Yeah, just trying to get better at manipulating the light so that I can get good medical results. Obviously, that's what I'm concerned about as a doctor. Medical things. Now, next thing I want to do. Yes, of course. No eye examination would be complete without the eye chart. Oh yes, it's that time. Let me get the eye chart. We're going to be utilizing a light to do this, and you're going to be thinking to yourself, how the hell are you going to utilize a light on the eye chart? Well, I'm about to show you, aren't I? Okay, maybe holding it this way will be better for me, and that's all that matters really, is what happens to me. Can you see already? The light is behind the eye chart, look at that. But also you can see through it, and it can highlight letters. How marvelous is that? How absolutely freaking marvelous is that? Oh my goodness me. What an incredible effect. Thank you, humans, for the invention of plastic. And what a wonderful invention it is, filling our bodies with microplastics and slowly killing us. Right on, thank you, plastic. Okay, this letter here, the top letter, the letter with the light behind it, what is that? E, good start. This letter. L, big fat L. What about this one? T, the Terminator. What about this one? F for fuzzy. What about this one? P for perpendicular. H for helicopter. O for ostrich. L for lemon. means you've got 20/20 vision. Well done, little human. Well done. Pat, 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 pat. Indeed, little pat on the head for you there. I hear some of you humans enjoy that, don't you? You little freaks. You little freaks. So adorable. So adorable. Now, next thing. Let's see. Yes. Yes, indeed. Yes, indeed. Close your eyes for me, please. Close your eyes for me. No cheating. Don't cheat, please. What I'm going to do now is I'm going to pass the eyes in front of your closed eyeballs, in front of your eyelids. It's going to go incredibly close. Could you tell? Could you tell just then I passed it in front of your eyes? Okay, good. I want you to tell me whenever it passes in front of your eyelids. You should be able to see. It's going to be a bit brighter, a bit redder, perhaps. That's right. There it is. Okay, I'm going to do it a few more times. There it is. Excellent. Brilliant. Amazing. Very good. Very good. Look at that. Wonderful. Wonderful performance. Wonderful performance. Okay, if you would like to open your eyes now, my little human, that's absolutely fine. You're welcome to do so. What I'm going to do now, the test is actually over. It's over. Okay, it's concluded. You passed. You passed. Well done. Well done. Flying colours. Flying colours. Your vision is perfect from what I can tell. Excellent in every conceivable way. Every conceivable way. Now, what I'm going to do, I'm going to put on a little bit of music. Let me put that on now, okay? There we go. You can probably hear that. It's a favourite of mine. It's like a little bit of a spa backing track music, you know what I'm saying? It's got those relaxing, healing frequencies, baby. Relaxing, healing frequencies. I love that shit. I love that shit. Okay. And what I'm going to do, I'm just going to shine this lovely purple light into your eyes with the peaceful music playing. And you know, if you want to relax, if you want to fall asleep, you're welcome to do so. So that smell remind me of? Some sort of food. Doesn't make any sense. Oh wow, these ones slide on like an absolute glove. Wait a minute. It is a glove. Okay, I'm ready to begin today's very serious neurological examination. Test number 1. Heartbeat test, utilizing, of course, the stethoscope. The stethoscope. Yes. Perfect, perfect, perfect. Let me just place this on your face. Few doctors know this, but the face is actually the best place to listen to the heartbeat. Can you hear that? No, you can't hear it because I'm the one wearing the stethoscope. But what I can hear is a fantastic, phenomenal heartbeat. Your heartbeat is so strong and steady. Excellent, excellent job, my fellow human. Excellent. Are you okay? You look a bit dazed and confused. Okay, you're fine. Now I need to listen to your lungs. Okay. I'm going to put this on your chest. You don't need to remove your clothing for me. Bit eager there, weren't you? You were a bit eager to take your clothes off then, weren't you? Okay, that's fine. I'll listen to it over the top of your clothes. Big breath in for me, please, just like that. Breathe out for me. Breathe in. Breathe out. I need to move the stethoscope to another location. Do it again. In. Good. Very good. Okay. I like what I hear. Off to an excellent start for today's neurological examination. Is that a helicopter going over the clinic right now when I'm trying to do a nice peaceful neurological examination? Have these people, have these humans no respect, no respect. See you later, helicopter. Don't come back. Don't come back. That's what I say. Right, next thing we're going to do today, of course, I need to feel around your face. Okay, let me get rid of this stethoscope. It's annoying me already. Bye-bye. Now, keep your face nice and still for me, please. Please don't move your face. I'm just going to be pressing and manipulating your face a little bit to see if I can induce any involuntary twitching. That's one thing I'm looking at. I'm also looking at the general elasticity of your skin. Okay. Obviously, we expect more youthful humans to have greater elasticity. I'm not sure exactly how old you are. Bit of an enigma. Just to look at, you're a bit of an enigma. Difficult to tell. Could be 100. Could be 20. Difficult to tell. Got one of those youthful grandma looks going on, actually. me know if it's uncomfortable for you though at any point. Okay, let me know if it's uncomfortable. It shouldn't be uncomfortable. There's no need for this to be uncomfortable now, is there? No. No, 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 no. Let me just do a little bit of this. Do a little bit of this as well. A little bit of this as well. Okay, interesting, interesting, interesting. I'll do this as well. 2 seconds, 2 seconds. Actually, this is very good for lymph drainage as well. Bit of a lymph massage that I'm inadvertently giving you here. Do you know all about the lymph? It's very important, very important. The lymph system, actually very similar to the cardiovascular system in that it runs throughout your entire body, except the lymph system does not have a heart. Of course, the heart pumps the blood all around the body. How does the lymph get around the body? Well, it gets around the body through mechanical movement, such as walking, moving your arms and your legs, or massaging. You can massage lymph around. Very important to keep the lymph moving as much as possible. It carries out all the toxins, all the nasty things that you don't want in your human body, you know what I'm saying? Get that lymph moving, baby. Go for a little walk. Go outside. You absolute goblin. Go outside. Enjoy the world whilst you can. The sun will explode one day and the earth will no longer exist. You won't be able to take in the sublime beauty of trees and fluffy clouds and beautiful flowers. It will all be gone, eviscerated in a gulf of extreme and explosive fire. Enjoy it whilst you can, you silly little human. You silly little human. Okay. That's enough of that. Did you experience any pain or discomfort during that? No. Okay, that's very good to hear. Incoming message from the big giant head. The big giant head would like to sample some of Earth's chocolate. He has heard tales of this fabled chocolate and would like to sample it for himself. In your next cargo delivery to the big giant head, make sure that you include some chocolate. Normal functions resuming in 3, 2, 1. Okay, the next part of the neurological examination today. What is it? I've forgotten what I'm doing. Right. We're going to use a light. In fact, this light right here. Okay. I need you to keep your head nice and straight for me, please. Focus your eyes on my nose. Tell me when the light enters your field of vision. Good. 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 Okay. Now, focus your eyes on my nose. Tell me when this leaves your field of vision. Good. 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 next thing that I want to do with you, still looking at your peripheral vision, continue to look at my nose, please. Now, this is called the finger wiggle test. Some fingers, they're gonna wiggle. Just like that. I need you to tell me which fingers wiggle, left, right, or both, starting now. Good. 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 Sometimes I see something in my mind's eye that I enjoy the visuals of quite a lot, and this is one of them. This is one of them. Don't you think that looks cool? Maybe not. Maybe just me. Maybe I'm stupid. Maybe I'm having a special moment. I have many of them every single day. Every single day. It's not going to be long before they realize and they lock me up in a padded cell where I belong. The next thing I'm going to do with you, still looking at the peripheral vision. Keep your eyes on my nose, please. How many fingers is that? 2, good. 3, good. Let's keep going. 5. 1, 2, 4. Good. 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 Okay, that's good enough. That's good enough. Let's see now. Next. Yes. I need the light once again, and I'm going to cover one of your eyes, okay? Plop. That's me putting my hand on your eye there. Very good. Now, you don't need to do anything for this, okay? I'm just going to be shining the light in and out of your eye, making some general observations. Just making some general observations here, okay? It's like a game of peekaboo, isn't it? Peekaboo. 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 And of course, a loud car outside ruins our game of peekaboo. Peekaboo. How absolutely bloody dare they? Listen to the scoundrels with their loud cars buying mufflers to enhance the volume of their car. Stupid. What do they think it achieves? What is it, an assertion of dominance, is it? Are they so afraid of death that they need to exert their presence on the world around them? Stupid, primitive little car drivers. Right. Part 2. Let me just cover that. I think that looks good, doesn't it? Okay, peekaboo part 2. Let's see if we can do this without a stupid car interrupting us. sound like a boomer. I don't even know the Pokemons anymore. Putting an S on the end as well. A plural. The plural of Pokemon is Pokemon. There's no need to call them Pokemons. That is such an absolute boomer moment. I apologize. I apologize profusely. Right. Next test. We're going to do something called the double vision test, baby. The double vision test. Focus your eyes on my finger. It's going to come closer to you, okay? Closer and closer and closer. Keep focusing. Keep focusing. Keep focusing. Keep focusing. Boop. Keep focusing, please. Keep focusing on the finger. These latex gloves, they almost look skin-like in certain instances, like around here. And it looks like I have a disturbingly wrinkly finger, doesn't it? Disturbingly wrinkly. As if I've been in some sort of liquid for too long. Submerged in a bathtub, out in the rain, in a chlorine-filled swimming pool for too long, and I've become a strange, wrinkly little creature. I think that's for friction or something. I can't remember the reason we go wrinkly. I think it's for friction. Not sure. Right, during that double vision test, did you see one finger the entire time, or did you start to see two? One finger the entire time. Excellent. Next, keep your head still. Follow the light. Using only your eyes, okay? Only your eyes should be moving. Your head should be remaining nice and still as you follow the light. What's that? The light's a bit bright, is it? A bit bright, is it? Oh, little baby can't handle the bright light. Shut up. Shut up. It's only going to be for a short period of time. If you don't like it, close your eyes. Time travel further ahead. You can do that, can't you? You can do that. You absolute buffoon. Keep following the light. Look, it's moving around, sort of like a little firefly or some sort of insect. Buzz, buzz, buzz. Buzz, buzz, buzz. How wonderful. I do love little insects sometimes. Sometimes they're quite whimsical and beautiful. Other times they're of course quite creepy and irritating. Bit like people, really. A bit like people. Oh, it's slowing down. Maybe he's got tired. Fireflies got tired. Bless him. Even fireflies need sleep, you know. Even though they're on the night shift. Bless them. Poor little creatures. The night shift absolutely sucks. Wouldn't wish the night shift on my worst enemies. Absolutely destroys your circadian rhythm and your health. And sometimes now they don't even pay you extra for it. What a disgusting economy. What a disgusting country. Disgusting system. Does not value our health or well-being in the slightest. You have to fight for your own health. And no one else will. No one else will. Good job following that light. Good job. Very good indeed. Now, the next thing I would like to do. Focus on the finger, please. Don't get distracted. You focusing on the finger. Hello. Hello. Don't get distracted. Don't get distracted. Keep focusing on the finger. Don't get distracted. Don't get distracted. Are you focusing on this finger? This one here. This one here. This one here. Look at that. I'm going ET mode on you. ET. That's not how I phone home. I mean, I'm a human, so obviously I phone home using a cellular device, just like you. Okay. Next thing I want to do with you today. Let's have a little look, shall we? Ah, yes. Everybody's favorite part of the test. The eye chart. Let me grab that for you now. One moment. That's the eye chart. We're going to be using that in just a second. Let me get a pointer though. And by a pointer, I mean a pen. This one shall do nicely. Simple pen for a simple task. Are you ready? Okay, good. What's that? Good. 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 You can even see the last line there. Well done. Well done. What's this colour? Red. Green. Excellent. Cover one of your eyes for me, please. I'm going to point to just a few random letters. Here we go. Good. Now, cover the opposite eye for me, please. Again, just a few random letters. Excellent. Very good. Very well done indeed. You can uncover your eye now. That's absolutely fine. It looks to me that you have 20/20 vision according to this little eye chart. Marvelous job. Marvelous job. Excellent. What a superb specimen you are so far. Now, are there more things I want to do with you today? I think so. I think so. Yes, of course. Part of any neurological examination requires testing of the hearing and of the ears as well. Okay, so I'm going to whisper some words into your ear. You're going to repeat back the word that I say to you. Understood? Excellent. Let's go. Word number 1. Sausage. What did I say then? What did I say then? Sausage. Yes, I love sausage. I love sausage. Next word. Squeaky floorboards in this clinic. I apologize if that irritates you. Maybe it doesn't. Maybe it's just me. I'm easily irritated. Easily irritated indeed. Right. Next word. Coconut. What did I just say then? What did I just say then? Coconut. That's correct. Coconut. Coconut. That's correct. Coconut. That's correct. Excellent. Next word. Let's go, baby. Let's go. Watermelon. What did I just say then? What did I just say then? Watermelon. Watermelon, baby. You know what I'm saying? Watermelon. Right. Next. Next word. was going to say something else to begin with. You filthy-minded individual. Filthy-minded individual. I would never say that word. Never. Never, ever, ever. We're going to do 2 more. Why not? 2 more. 2 more. Hash browns. What did I just say then? What did I just say then? Hash browns, yes. Anyone who is a fan of the full English breakfast knows exactly what a hash brown is. Oh Lord, I love them hash browns. Probably not good for your health though, you know. Flip health, innit? Flip health. Only live once. Or do we? I don't know. Right, next. Final word. Final word. Black pudding. What did I just say then? What did I just say then? Black pudding. Yes, black pudding uses pig's blood in it. Oh my goodness me, pig's blood in food. That seems crazy, doesn't it? Pretty sure the Spartans used to have stew in animal blood though. Maybe pig's blood, I can't remember. Probably how they got so absolutely gigantic. Let's return to vampirism, you know what I'm saying? Okay, what is the next thing? What is the next thing that I'm supposed to be doing to you today? Yes, close your eyes please. Close your eyes. I'm going to be making this sound. I'm going to move it further away from your head and you're going to tell me when you can no longer hear it. Okay, here we go. Starting now. Tell me when you can no longer hear this sound. Good. Again. Good. Just the one side now. Good. Again. Good. This side now. Good. And again. Good. Excellent job. Excellent job there indeed. Excellent job there indeed. Keep those eyes closed though. Keep those eyes closed. Now, let me just grab a little object. Utilizing this object, I will be creating sounds either side of your head, and your job is to tell me which side of your head you hear the sound, the left or the right. Okay, let's go. Left or right? Excellent. Left or right? Excellent. Left or right? Excellent. Left or right? Excellent. Left or right? Good. 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 Very good indeed. Very good indeed. Now, I'm going to use another object. Let me just get it. One moment. Okay, I'm going to be producing this sound. Okay, and what I'm going to do is I'm going to make 2 sounds, and I want you to tell me which of the 2 sounds is closer to you. 1 or 2. sufficient. I think that's sufficient. Do you want to open your eyes for me now? Okay, you have done absolutely stupendously well today. Stupendously well. Very proud of you indeed. Thank you so much for following my instructions so well. And your performance was brilliant, which means I do believe your neurological processes are functioning 100% efficiently, as they should be. So you're a healthy little bunny. Yes, healthy little bunny. Well done. Well done. Now, that's the end of today's appointment together. So you can leave now. You can leave whenever you'd like. But I'm just going to write some notes down for today's appointment together. You don't need to stay here for this though, so I'll say good night to you now. Okay? Good night. Bye. Sensory perception. Let me shuffle these cards though before we begin very quickly. text? I don't know. That's peculiar human expression. Okay, first card. This is a red card. I'm sure you can see and tell. What do you think the next card will be? Red or black? Let's find out, shall we? Let's find out. 3, 2, 1, guess. It's a red card. It's a red card. What about the next card, though? Do you think the next card will be red or black? Let's find out. 3, 2, 1. Red. It's a red card. What about the next one? Red or black? Let's find out. Let's find out. 3, 2, 1. Red again. Red again. Where's all the black cards in this deck? There should be a 50-50 chance. At the moment we're going against statistical probability here. We're going against it. Next card, red or black? Let's find out. 3, 2, 1. Another red. Another red. What's happening here? Were we stuck in some sort of loop? Some sort of loop? Is God playing some sort of game on us? Some sort of little trick? Let's guess the next card. Red or black? What do you think? Red. Red again. Of course. Next card, red or black? What do you think? Red again. Red again. What? We are stuck in a loop. Is this the Matrix? Is this the Matrix? Red or black? Red. Red. Oh, thank God. A black card. Finally. Finally. How many cards did we go through there? Let me just double check. Let's double check. So, we went through how many cards total? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 cards. Of those 10 cards, statistically speaking, 5 should have been black. Obviously, things aren't perfect. They don't follow statistics perfectly. That's where gambling comes in, right? But to get 1 black out of 10, you would think it would be a 10% chance of getting a black, but no, it's a 50% chance. How does that make any sense? How does that make any sense? Okay, we're off to an unusual start here. Off to an unusual start. It's okay. It's okay. We keep going, okay? I'm shuffling the deck again a little bit more. Obviously, I'm not very good at shuffling, though, am I? Clearly. Or something. Something's going on here. Something is going on here. It is you. Are you playing a trick on me? Are you playing a trick on me? Okay, on to the next game. Utilizing the cards still. Okay, this game is called Higher or Lower. Now this card has a value of 8. I'm sure you can tell because there's a number on it. 8. Okay, now what do you think the next card will be? Higher or lower in value than 8? Okay, the next card is higher. It's a 9. It's a 9. Okay, now higher or lower than the 9? What do you think? Let's have a look, shall we? 2 lower. Okay, this next one should be easy for you. Higher or lower than 2? Let's check, shall we? Ace. Is that high or low? I think it's either, isn't it? I think it's either 1 or... What's the value? 19. I forgot the value. I haven't played cards or anything like that in quite a while. Silly me, I should have checked really before doing this exercise with you today, shouldn't I? But I'm an idiot. I'm an idiot, aren't I? Okay, next card, higher or lower than the ace? Let's see, shall we? Another ace. Another ace. I didn't give you the option to say the same value, did I? Silly me, or silly you. Really, you should have anticipated that this would have been the same value as the previous card. shower, okay? So my hair is wet, but it's not greasy. In fact, it's probably the cleanest that it will be at any point in time, because I've just had a shower, okay? Something you wouldn't understand. Looking at you, you greasy little creature. I can see your skin. That's not moisture. That's not natural moisture. That's grease. You're the greasy one here. You're the greasy one, not me. You're the greasy one. Maybe you should try having a shower once in a while, huh? You think about that? Think about that, you greasy little human being. Take a shower. Okay. Next. Yes, of course. I have a number of questions to ask you. Short questions requiring short answers. So we shall go through them very quickly. One moment whilst I grab my questionnaire and my pen. Let's see, this pen here, yes, it's calling to me. This pen here is calling to me today. Oh, silly me, get back in there. Right then, are you ready to answer some questions for me? Doesn't really matter if you're ready or not, because I'm going to ask them and you're going to answer them like a good little human. Okay, now then, question number 1, let's see. Spell out your full name for me, please. Good. Now, your date of birth. Good. Now, your mother's maiden name. Good. Now, your first pet's name. Now, the long number on the front of your credit card. Good. And the expiry date of your credit card. And what is the little security code on the back of your credit card? Very good indeed. Well done on answering those questions there. Very essential questions indeed to figure out your cognitive ability. That was the purpose of those questions. Of course, all part of the test. You can trust me. I'm a doctor. Okay, now then, yes, I'm going to need to take some photos of you. So, if you could stay still, perfectly still. Okay, let me grab my camera. Here we go, I've got my camera. Stay still just like I mentioned before. Brilliant. I'm taking multiple photos, so stay still, don't move. I will move. You stay still. Okay, need the perfect photo from a number of different angles. You don't understand. You wouldn't understand, really. Judging from how this test is going, it seems your cognitive ability is actually quite low indeed. Even lower than previously imagined. Shockingly low, in fact. I do wonder, in fact, at what point can a human be considered not a human? Because there has to be a point, right? There has to be a point where your IQ is so low that you can't even be considered human. You know, you'd be considered more like a banana or something. You know what I'm saying? Something with, I wonder what the IQ of a banana is. Probably about the same as you, I imagine. Probably. Stay still. Okay, I need one more photo. Yes, of course. I remember exactly now. The next instruction that I need you to follow, I need you to tell me, please. Wait for it. Wait for it. I have an object here. I have an object here. It's stuck. It's stuck. Look at that. It's rock solid. Ah, there we go. There we go. Excellent. There we go. Now it has returned to its correct form. This, as I'm sure you are aware, human, is a slinky. A slinky slinky. I love slinkies. Slinky doodles. Very cool, very cool. But, human being, can you tell me what is the color of this slinky? Green. Yes, indeed. Excellent job, human. Excellent job. So, you did that one correctly, but what about this one? What about this one? What color is this slinky? Tell me, human, what color is this slinky? Orange, yes. Very good indeed. Orange, 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 orange. What about this one, though? I bet you can't tell me the color of this one, can you? Got you stumped, haven't I? Got you absolutely stumped. Yellow. You think that's yellow? Or is it a lime green? I suppose it could be either. I suppose so. Perhaps I'll let you off that one. I suppose so. But what about this? What about this little object here? My little human. You like that? You like that right up in your face? Right up against your eyeballs? What color is it? Yellow. Of course. Magical. Yellow. Sparkly fuzzy ball. Magical. Yellow. Sparkly fuzzy ball. Magical. Yellow. Sparkly fuzzy ball. What about this one, though? What about this one? This one, much softer. No sparkly appendages. Merely a soft fuzzy ball. What color is it? Red. Yes, well done. It's red. Excellent job. Excellent job, human. Excellent job. But what about this one? Look how small it is. Look how small it is. What is that? Is that a pea? Is that a pea? Is it a legume? A little edible legume? Is it? You can't even see it, can you? It's so small. Your primitive human eyeballs can barely comprehend what it's looking at. What color is it, though? Green, of course, green. Well done. Well done indeed. Okay, now then, keep focusing. This is important. Keep focusing. What about this little rubber dinosaur? Rubber dinosaur. What about him? What color is he? Blue. Yes, that is a blue rubber dinosaur. Look how wrinkly he is. This brother has been out in the sun for too long. You know what I'm saying? Someone forgot to put on his skincare products. Naughty little dinosaur. Foolish dinosaur. What are you looking at me like that for? There we go, that's better, isn't it? Now, what about this dinosaur? Different shape, maybe a different species, or a different subspecies, I don't know. I'm not a dinosaurologist, am I? No. What color is this dinosaur? Orange. Yes, he's also wrinkly. I guess dinosaurs are just wrinkly little creatures, kind of like those naked cats. You know what I'm talking about? I actually love those naked cats, they look so cool. Wrinkly little dudes. What about this one? What about this dinosaur is missing a limb. He's missing an appendage. How could he possibly continue? No, I'm sure he'll be fine. Don't worry. Yellow, correct. He's a yellow dinosaur, and I think he'll be just fine even with his missing arm. It's okay, dinosaur, it's okay. Okay, right. Next, I actually have some friends of mine that I need you to identify the color of. Look at this little fellow. Look at this little fellow. Can you please tell me what color is he? It's okay, it's not racist. It's not racist. Orange, yes, orange skin color. It's okay, this species, they're not as primitive as humans. Not as primitive as humans. They don't care about skin color, so it's not an issue for you to identify them by their skin color. It's not an issue. It's not an issue. So what color is this alien creature? Pink. Yes, pink. Little pink fellow. Next, this is the final little alien creature. The final creature that I need you to identify the color of. What color is this alien? Green. Yes, a little green alien. Hello. Hello there. Hello. Absolutely marvelous. It looks like you can identify colors correctly, and it looks like you have an attention span capable of looking at different objects and identifying their colors. That's fantastic. That's fantastic. Well done. Well done, you. Brilliant. Absolutely brilliant. Now then, I need you to wait a minute whilst I grab something. Keep your head still for me, please, and use your eyeballs to follow the light as it moves. Okay? Follow the light as it moves. It's going to move in unusual ways. Unusual ways. You might find it difficult to focus. You might find yourself becoming hypnotized. Hypnotized by the light, by the sheer aura of the light. This light has aura, and to be in its presence is a blessing, an absolute blessing. Are you continuing to focus? You'd better be. You'd better be focusing hard on this light as it moves. Oh, magical. What an interesting little light. It's quite different, isn't it, to most? Quite different indeed. Phenomenal, I think. Phenomenal. Okay. Light is going to be teasing at the edges of your vision, but you must be following it as much as you can. Keep your eyes focused on it, please, whenever it is in your sight. Whenever it is in your sight. There. 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 And it's on the move again. And you'd better be following it. I swear you'd better be following it as it scans. It's scanning you. It's coming in closer for a little scan. Scan, 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 scan. Scan, 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 scan. Scan, 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 scan. Scan, 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 very impressive. Very impressive indeed, I must say. So far today, you've been following my instructions absolutely perfectly. And I think you're doing very well indeed. I only have a few more tests that I want to do with you today, but they do require me to put on some gloves. Okay, so let me just get my gloves. Where are they? Where are my gloves? Goodness me, what an absolute ordeal that was. Absolute ordeal to get these gloves out. These ones be smelling strange, in a good way though. I'm getting comfortable, okay? There's no need to look at me like that. Have some patience. Now then, the first test I want to do with you today, utilizing these gloves, it's called the finger wiggle test. Keep your eyes focused on my nose and tell me which finger moves, left, right, or both. Starting now. What was that, left or right? Good. 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 Very good. Very good indeed. I sort of enter a trance-like state when I do that. Do you? Maybe it's just me. I don't know. Okay. The next thing I want to do with you today. Look at my nose again. Okay. I'm going to move my fingers in various different directions. Tell me when they leave your field of vision. Let's go. Perfect. Let's go again. Perfect. Let's go again. Great. Let's go again. Great. Let's do that. But I'm going to take a big step back from you. Let's do it again. Good. 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 Very good indeed. Well performed there. You are excellent. something important though, so it's okay. We'll allow it. We will allow it today. Now then, stay there. Stay where you are. Look at my finger. Keep looking at the finger. It's going to move closer to you. And it's going to move further away. Keep looking at it the entire time. Keep focusing. Keep focusing. Keep focusing. Excellent. Continue to do it. Continue to look. Continue to look. Continue to look. During that, did you at all see two fingers? Did you experience double vision at all? No. Brilliant. That's very good. Very good indeed. Brilliant job. Brilliant job. Okay, let us do this. I'm going to be testing your ears now. Tell me when you can no longer hear this sound. I'm going to move it further away from you. Good. Again. Good. Let's do one side. Good. The other side. Good. Okay, that's excellent. Now we will do one final test to check your ears and to check your cognitive functions. I'm going to whisper some words into your ears and you're going to repeat back to me what I whispered to you. Okay, let's go, baby. Let's go. Word number one. Word number one. Here we go. Medieval torture. What did I just say? What did I just say then? Medieval torture. Correct. Correct indeed. Let's go. Let's go. Next. Next. Old Testament. What did I just say then? What did I just say then? Old Testament. Yes, indeed. Yes, indeed. Let's go again, shall we? Let's go again. Apocrypha. What did I just say then? Having a bit of trouble. Apocrypha. Apocrypha, yes indeed. It's a collection of books that were supposedly meant to be included in the Bible, but for various different reasons were not included in the Bible. They are considered non-canonical. Canonical, is that the word? I don't know. I don't know. But, you know, some of them considered heretical, some of them considered not real, inauthentic, different things like that. Very cool though, very cool. Sorry, got a bit distracted there, didn't I? Got a bit distracted. Let's keep going. Let's keep going with the words. What? Listen now, and repeat back to me what I say. Falafel. What did I just say then? What did I just say then? Falafel. Yes, falafel. Pretty good. Pretty good. Pretty tasty, I guess. Sometimes a bit dry though, isn't it? Sometimes a bit dry. Right, next. Next. Peter Pan syndrome. What did I just say then? What did I just say then? That was quiet, wasn't it? That was quiet indeed. Peter Pan syndrome. Yes, I definitely don't have that. I don't have that. No. Next. Alien homeworld. What did I just say then? What did I just say then? Alien homeworld. Yes, indeed. It's a bit weird, that phrase. Why would I say that? Why would I say that? That doesn't make any sense. That doesn't make any sense. One last word then, shall we? One last word. Here we go. absolute knuckle dragger. But it appears that not only can you follow basic simple instructions, but you can do everything correctly as well, without any fuss, indeed. You are fantastic. You are fantastic. You should feel proud of yourself. You should feel proud of yourself. Give yourself a little pat on the back. A little pat on the back. Pat, pat, pat. Pat, pat, pat. Pat, pat, pat. You know what I'm saying? You know what I'm saying?